Well, during yesterday's briefing, Dr. Fauci also said we might be seeing a plateau when it comes to the average number of new coronavirus cases every week. But a newer strain of the virus, first found in the UK, has now been identified in at least 20 different states. Yikes. Dr. Fauci says that strain and the new variant discovered in South Africa are more transmissible, but they may not be deadlier. Our Dr. David Agus joins us now to discuss that. Let's start right away with that, David, because I like the not deadlier part, but the more transmissible is a little disconcerting. Can you explain what is happening here, what this means?
So what happened is the virus, the spike protein, has changed. And the spike protein is how it gets into our cells. And it's binding more tightly. So in the beginning of the pandemic, the first 10, 11 months, say it took 10 minutes of a conversation 4 feet apart for me to give enough particles to you to spread the virus. Now that number is half or a third. And so much more transmissible. Smaller amounts of time, smaller amounts of particles, I can transmit you the virus. That's what gets us very scary. This plateau we're seeing now may start to take off as this variant becomes dominant across the country.
So why is this popping up now? Is this a common thing with these kind of viruses?
Well, yeah, I mean, these viruses change. Over 1 million years, our genome changed 1%. These viruses can change 1% in a day. But for the first 10 months, we were slowly getting infected in the country. Now, 30% of the country is infected, and we're starting to vaccinate. So we are changing, so the virus is changing in return. And what we're seeing is get more aggressive in terms of being able to be more infectious. The clinical outcome's the same. I mean, you're not going to get sicker with this variant, but it's easier to catch.
Do you think the vaccines, everybody's excited about the vaccine, everyone's trying to get it. Will it be effective against this new variant strain?
I am so excited about the vaccine. I mean, I literally am in tears every day if I get a note from a patient, I got it. What we know is the UK variant, the variant from England, the vaccines work efficiently again. But the South African variant is the real worrisome one. Many of the monoclonal antibodies, which bind to a tiny part of the spike protein, aren't binding. And what we're seeing with some of the people who've been vaccinated or have been exposed to the prior versions of the virus is that their antibodies aren't binding well. So we don't know the true answer yet. There'll be some immunity, but probably not 100% immunity like we see with the vaccines with the other strains.
What do you think of what you're hearing so far, David, about the Biden plan to attack COVID?
100 million doses, 100 days. You know, I like putting a stick in the ground. I think he's going to dramatically exceed that. If we look at the supply of vaccines coming from Moderna, Pfizer, J&J, and AstraZeneca, I think he may be able to do 200 million in the first 100 days. So that part I'm excited about. There's a real strategic plan for every aspect of fighting this virus, of going on offense in the country. If we all follow, if we stop the spread of the virus and this plan takes act, we're going to get by summer some thing toward herd immunity and hopefully get a more normal fall.
How likely is that? Dr. Fauci said the other day 75 to 80%. If we get the vaccine, we could have 75 to 80% herd immunity.
Listen, it's doable, right? But what we got to do is roll it out. Many states have half the vaccine sitting in freezer. A vaccine in a freezer and not an arm, to me, is unconscionable. We have to do better, and we have to get more aggressive in getting this vaccine out.
And the question I have to ask you about Dr. Fauci, because he seemed downright giddy yesterday at that press conference, even used the word liberating. What do you make of his change in attitude? Did you understand his apparent glee?
I love it. You know, the conversations I have now with the administration, they're about science, data, people talking back to me in a new way. I mean, I'm giddy. I think everybody who is fighting this virus is feeling a new sense of optimism and to be part of a team that really gets it.
All right, Dr. David Agus, thank you. We like people who get it very much. Thanks a lot.